Stroke is the second biggest killer in London and the most common cause of disability. But stroke care in the capital is being transformed thanks to the London New Stroke Model of Care and the work of the London Cardiac and Stroke Networks.
There's been huge changes in terms of the way we are now approaching stroke in London. The Strategic Health Authority, the primary care trusts have invested a huge sum of money, extra money into stroke, so £21 million every year. And the plans now are that people will get immediate access to very high quality acute stroke care, so they'll be taken directly to one of the 8 hyperacute stroke hospitals, regardless of where they are in London. Once they arrive in one of these hyperacute units, the scanners will be ready for them to go straight into. They'll be seen by specialists, both doctors and nurses. If they are suitable for clot-busting treatment, then they can get that very quickly. They'll be admitted directly to a stroke unit that is staffed by people who know exactly what they're doing. And then after that, there's also been a lot of investment in terms of getting people better quality rehabilitation, both in hospital and outside once they leave. The extra investment that's being spent is largely being spent on extra staffing. So I think people will notice the difference is that there are more people around, more people with specialist expertise in stroke that are able to provide them with that treatment. And that's from the consultant physician throughout the junior medical staff. It includes a lot of extra nurses. We've recruited over 400 extra nurses within London.
The new model of care in stroke in London means for nurses that we've finally got a staffing level that has to be met. So we know exactly how many nurses we should have for hyperacute stroke care and for stroke unit care, and really push up the standard and quality of nursing care because of those increased numbers. We're also doing a project across the whole of London to develop competencies, particularly to start with for the hyperacute stage, so that we're very clear on what nurses should be able to perform. I think the benefits for nurses in the new model is around improving the standards of care. I think it makes nursing more attractive in stroke. Stroke nursing has never been the most desirable option in your professional career, and now it's become interesting and people can see the benefits, and you get to see the patient from the very early acute stage right the way through till the discharge from hospital, so it's very rewarding, and the London plan has helped that.
The new stroke model of care estimates that more effective rehabilitation could transform the lives of 6,000 stroke survivors every year. And the London Stroke and Cardiac Networks are working to ensure that all stroke survivors in London receive excellent rehabilitation wherever they live. But it's not just PCTs and hospitals who have a vital role to play. The voluntary sector in London are also key in delivering stroke services.
Just explains on the back about the risk factors.
We have a number of initiatives that we use. One is the community health worker who goes out into the community and provides NHS health checks. We target specific age groups, for example, males 40 to 64. We go out to places like snooker halls, etc., libraries, and we carry out NHS health checks. We then offer information and advice and inform about risk factors. And then we try to set goals with individuals about how they could reduce that risk factor of stroke. I was 17 when I had my stroke, and I think with the initiative of the National Stroke Strategy, that's helping to put things in, protocols in place, making sure that services are there for individuals once they've suffered strokes. It's very important that, you know, once the point of discharge has been reached, that there are services out in the community. It's vitally important because it stops people actually going back into hospital for various reasons on recovery. So the stroke strategy is a belter, is a plus.
Local NHS organisations in London have been introducing new stroke services since early 2010, ensuring that all patients will have access to world-class specialist care.
A patient can expect to receive much quicker access to high quality care both in the acute part of their stroke, through their inpatient rehabilitation and then out to their community rehabilitation. They should expect that those services will be joined up and that there shouldn't be any delays between the transfer of the patient out of hospital and back to home.
My vision for stroke in London is firstly that we reduce the incidence of stroke, so there are fewer people that are having strokes, and for those poor people who do end up with a stroke, that we can give them, every single one of them, the highest possible quality of care.